I spoke to another leader working on some really big problems. Steve Stirling is the president and CEO of MAP, a nonprofit organization that provides life-saving medicine and health supplies around the world, and previously was executive vice president and chief administrative officer of Child Fund International, a leading international child-focused development nonprofit. He's definitely a leader that understands the power of good management. Hi, Steve. Please tell us about MAP.
The medicines you and I take for granted, things like hypertension medicine, cardiovascular medicines, diabetes medicine, or simple as antibiotics. 2 billion people in the world do not have access to that. So that's MAP's mission, is how do we get medicines to the people in need around the world. So we were very fortunate last year to help 26 million people get access to life-saving medicines. We have pharmaceutical companies that will donate over $600 million of very good medicines that they cannot sell anymore. And we get to take those medicines, and we raise money and ship it all over the world.
You rely on volunteers. What's your management strategies for managing a volunteer workforce?
What's really important to engage volunteers and donors with an organization like MAP is to really connect with their heart. And for me, the best way, and this is part of my story, is how did I end up at MAP? Because I had polio as a child, I did not get access to the polio vaccine. And because of that, my life took a different turn. By telling my story, people could connect to what happens if you don't have access to a vaccine like polio vaccine. And many people around the world do not have access to simple medicines that you and I take for granted. Once the volunteers come to MAP, the important thing is how do we engage them in a personal way and ask them why are they volunteering at MAP, and then also to share stories of how their efforts are helping people around the world by sharing success stories, and to say what you're doing each day when you volunteer at MAP is making a huge difference. But when they see that what they're doing, be it an hour a day, it could be an hour a week, they can see what I'm doing does impact somebody's life halfway around the world.
Thank you, Steve. To generate the best outcome, you must constantly evaluate and apply the best science and consistently deliver that science throughout strong management and leadership. Making progress against serious threats takes even more dedication, long-range vision, and a commitment to make change slowly over many years. As an example, we will take a look at Nepal's exemplary performance on improving vaccination coverage since the turn of the millennium. Nepal's terrain is highly varied, from the world's highest mountains to the lowland Terai region that is home to half of Nepal's population. This may make Nepal's experience with improving service delivery and health outcomes especially instructive for other nations that must deliver health services across challenging geographic features. In 2000, according to the World Bank, the death rate for children under 5 in Nepal was 81 per 1,000 live births. But by 2019, Nepal managed to cut that by 62%. Moreover, Nepal improved vaccine coverage from 74% in 2000 to 86% in 2019, a key contributor to the reduction in under 5 mortality. How did Nepal achieve this success? I'm speaking to Dr. Samir Dixit, who is the Director of Research of the Center for Molecular Dynamics, Nepal. He has worked as a national consultant in various infectious disease projects, is a founding member of the Nepal Public Health Foundation, and in the past has served as an advisor to Nepal's Ministry of Science and Technology and Ministry of Health and Population, and as a member of a high-level technical committee formed by the Ministry of Health and Population in Nepal to tackle the global coronavirus outbreak. Hello, Dr. Dixit.
Hi, Zainab.
You've worked with exemplars in global health to research how Nepal achieved amazing success in improving immunization rates. Can you tell me how Nepal did this?
There were many factors leading to Nepal's success in vaccine delivery. But today I'd like to focus on 3 main factors. One is the Nepal's Ministry of Health and Population, which fostered a strong partnership with external partners and the community to align its priorities and the resources that were available. And then the second factor was that Nepal gathered and utilized data effectively, especially for policy and the program in terms of management and to support evidence-based decision making. And then thirdly, Nepal generated a demand for vaccines. I mean, the demand is very important. If people don't want it, then you are in big trouble. So that the demand for vaccination was developed among communities with the help of strong and empowered female community health volunteers, whom we call FCHVs. So that workforce was used to spearhead the education and outreach in communities. So these were I would say, the main three factors.
How did the Nepali Ministry of Health and Population build strong partnerships and align priorities?
So Nepal's Ministry of Health and Population, MOHP, helped foster this spirit of partnership through complete transparency with regards to decision making and vaccine effectiveness. Also, they focus on the consistent and reliable service delivery as in terms of explaining to the people, open communication of government policy to the communities, because communities play a very important role, ensured cultural values of altruism and collective responsibility. Moreover, as a sign of commitment, Nepal codified healthcare, including vaccination, as a human right in the constitution and backed it with a reliable service provision. So all these were very important activities of the Nepal government also.
How did Nepal engage communities, build demand, and manage service delivery?
Community outreach is a key part of Nepal's success. There's no doubt about that. For one, Nepal generated the demand for vaccinations through community engagement, media, and also school outreach programs. The Ministry of Health and Population recognized that different approaches were required to reach different groups. Nepal developed very strong and highly empowered FCHV workforce, and you will note that they are very empowered and they're very, very respected. And so there's empowerment, but then there's a respect factor also. They play a very key role in creating demand for vaccines. They even remind the community, this time for vaccination, you should take them children for vaccination. This is the date for vaccinations. And also, fully immunized districts are given, recognition in the media, at the government level, so that people who are involved feel, oh my God, I've done some good work, So the very good motivation factors are in place.
Thank you for joining us, Dr. Dixit. Tenacity is key to tackling the problems we face in the future. We need so many more people driven to address the challenges that humanity faces if we are to thrive as a species in the decades to come. But tenacity, passion, and even science alone aren't enough. When a passion to improve the world, grounded in science, meets strong leadership and management, then the real success is possible. When we focus equally on what needs to be done as on how it gets done, amazing things can happen. Management and leadership are sciences in their own right, as well as an art form. As much effort as we put into evolving our traditional sciences and research, we need to invest to advance our collective skills in management and leadership. Our science often gets ahead of our capacity, our politics, and our ethics. If humans are going to make it, we need to not just become more powerful thinkers, we need to become better actors on our own behalf. As Goethe said, knowing is not enough. We must act. Willing is not enough. We must do. Thank you for joining me in this series. To share your experience and wisdom with others, I encourage you to explore and contribute to 9lessons.org throughout your journey to becoming better ancestors, and as you go on to create positive change in our world. See you again soon.